Hi, I'm Dr. Ron Miller of Pursuit Physical Therapy, and today we're going to go over a case of a patient who had a neck fusion done. Actually, had two neck fusions done, and she was still experiencing neck pain and ridding arm pain. And what we were able to do with treatment to get her to a point where she got off of all of her pain meds, and she had minimal to no neck pain and all of her arm pain resolved. And maybe she had anywhere from a 0 to a 3 out of 10 neck pain. So because there's a lot of patients out there, and a case just came up where someone asked me about this, if we can help them or not. They had a friend who had a neck fusion and they still had really bad arm pain and they still had neck pain even after a fusion. Okay, so just going over whether someone should get a fusion or not, that's a whole nother story. What we want to do today is kind of go over a case of what we had here and how we treated that case to help get rid of any of the neck pain or the radicular symptoms. So just to summarize really quick, we had I believe she was in her 50s or 60s, a case of 10 years ago. She had a neck fusion and had a lot of neck pain and still had that reading arm pain. And she went through therapy for years, went through pain meds, and symptoms just kept on getting worse, and she was pushing through her pain. It got bad to a point where she was on, baclofen, anti-inflammatories, muscle relaxers, and still had 7, 8, or 9 out of 10 pain in her neck and shooting arm pain, where she consulted with another surgeon, did new imaging. This is almost 8 to 10 years later, and they ended up doing a second fusion on that next level up. After the second fusion, she still had severe neck pain. She still had her ridding arm pain. And then she went through standard PT, and then 2 years after surgery, she consulted with me to see if I could do anything about that. So we got her in for an eval, did a thorough assessment. We actually found that yes, she was still lacking neck motion that was causing some of the neck pain. But the interesting finding was a lot of the reading arm pain that she felt, the numbness and tingling, was actually coming from the pec and the first rib area. It was so hypertonic and compressed that it was pinching on a bunch of nerves, causing her radicular symptoms. That's called, not to get too scientific, but the brachial plexus. All the nerves that innervate the arm here all start up here. Yes, they do come from the neck, but the cervical fusion should have fixed that. So it opened up the space, but her radicular arm symptoms were not coming from her neck. It was actually coming from her first rib and pec. So how we treated this, yes, we maximized the mobility around the neck, and that gradually decreased her neck pain and any kind of myofascial pain she had. But the key to her treatment was resolving that arm symptom, was really working on the site of where the nerves were being compressed, with increasing pec flexibility, mobilizing the first rib, and her arm symptoms actually gradually resolved. And then we were just treating a neck pain patient after we solved that. So she actually had 2 or 3 different diagnoses that were causing her symptoms at that time. And then from there, once her arm symptoms resolved, we were able to start working on some of the myofascial treatments, maximizing the neck mobility above and below the fusion site. That opened up more space there. Then worked on some strengthening as her pain got down. We actually designed a customized program where so she was on 3 different types of meds. We were going to treat her for 3 weeks. As pain went down, she was going to consult with her physician and say, okay, I want to get off of these meds. I'm going to pick one. So she picked off one, kept on going. Her symptoms kept on getting better. The next month, she was like, okay, I'm feeling pretty good. I have no more arm pain. I only have like a 4 out of 10 pain. So she picked the next med to get off. And then after that 3rd month of treatment, she was actually able to wean off of all of her medication, and her symptoms still stayed down. And that's how we knew that we were solving the root cause of her symptoms, and not just relying on the fusion or some sort of imaging to solve that problem, because who knows what was the source of why you may be having your pain right now. It could be a neck problem, it could be something else. And then after she was done with all of her meds, she would have a little bit of neck pain after work, but nothing at the level of a 6, 7, or 8 out of 10 pain. Her pain after work may have been a 3, and it was manageable, and she knew what exercises to do to help decrease her pain. So at the end, whenever we finished up, on a good day where she didn't have to work, she'd have minimal to no pain and no more arm pain. And then as she got back into doing things, maybe she'd have a 2 or 3 out of 10, but she knew exactly what to do to kind of manage it herself. After having 2 neck fusions and being on strong pain meds, this was still considered an excellent outcome. So if you're struggling with symptoms even after having 1, 2, or 3 neck fusions done, there's always hope. There's always answers of why you're in pain. The goal is to kind of solve that, maybe even take a step back and look at a different approach, outside of the box thinking, to kind of solve why you may be having your pain. So there's always a reason of why you're having it. It's just us. It's up to us as medical professionals to kind of solve that for you. So if you're dealing with neck pain or even radiating arm pain, even after having a neck fusion, give us a call or comment in the comment box below. We would love the opportunity to help, at least consult with you to see if we can help at all, before you turn the route of going into pain meds and stuff. So if you have any questions, you can visit the website at pursuittherapy.com or give us a call or text at 407-494-8835. I hope you learned something from this video, and then we hope to see you soon. Thanks.